And good evening and welcome to everybody this evening. Welcome to the Midwifery and Maternity Hour, or Hour. My name's Sue MacDonald. I'm the curator for the Maternity Midwifery Hour and the Midwifery and Maternity Festivals. And it's my pleasure to be chairing this evening's session. Tonight is week 2 of the 16th series of the hour. And we're joined by Patience Gyampeh this evening, and we're delighted that she's with us, and we're going to put her on the spot. We just have patience, but I think we're going to have a really fantastic hour this week. So Patience, could you share your moment of the week with us all, please?
Yes, sure. Hi, Sue. Hi, everyone. My moment of the week. So, I am an associate professor as well at the University of Suffolk, and I am currently a PhD candidate. So, I have been through ethics application, and everybody and anybody that knows me knows that this is been the most interesting journey, um, to put it nicely. However, I've had some good news. I've had the clearance, so you have to go through. Well, I needed to go through ethics, so the university ethics panel, and it's all come back nice and green lights to go for both. So
Wow.
yeah, so I'm all good to commence my studies. I'm really, really excited.
Oh, that
Excited.
is, I think that's not just a moment of the week, it's a moment of the month, it's a moment
It
of the
really
year.
is.
That's fantastic, because I suspect that anyone who's doing research, whether it's master's or PhD, whatever, and experienced seasoned researchers will all be cheering at you, Patience. So well done. That is absolutely fabulous. And congratulations for that. Now we're going to let Patience have a little break before we bring her on again. And I'm just going to say the usual welcome to everybody. Now I know we'll have people who are regular audience, so hello to you all. And we'll probably have quite a few new people. So I always say at this point where we came from, which was the COVID-19 lockdown, the first lockdown in the UK. This is where the Maternity and Midwifery Hour was born. So we want to make midwives, student midwives, anyone actually working in maternity service, or mums and parents also, had access to some information at quite a scary time. And those of you who were working in maternity 5 years ago will remember how scary it was. We didn't know very much about COVID. It was new, it was scary. You forget things like the rules kept on changing and all these bubbles that people were talking about. And we had to get our head around all of that, let alone all the hand sanitizer and the masks and everything. I have to say, I have got matching masks for just about everything in a huge drawer in my room. They'll be used at some point, maybe when I've got a cold or something. Anyway, the maternity hour was a way of making sure we had the connection with midwives and student midwives and anyone who was working in service. And it was a way of getting information out there and also reiterating everything we do on the Maternity and Midwifery Forum is recorded. So if you should have a power cut this evening, don't panic because you can catch up tomorrow. Just think I need to say that. Or in case a mouse eats through your broadband cable, that has happened to somebody on one of our festivals once. I say also for this Facebook page, and I would recommend this for those of you who are doing courses, if you're up for revalidation, if you're doing a dissertation for college work, have a look at the kind of material there, because we've got hundreds and hundreds of video clips. It's a really good way of getting up-to-date information for whatever work you're doing. And there is a small subscription, but a lot of the universities now subscribe. So if you're one of those lucky students belonging to one of those universities, it's all for free. So do get a chance for accessing. I will say, bit of a health warning, once you start having a look at these clips, you'll get hooked in and you'll want to watch more and more and more. So that's your health warning for this evening. Now, last week I wasn't here and Neil was holding for genomics, and that's really interesting. I'm going to have to catch up with that. I was at the RCM conference in Birmingham, which was a fantastic event, fab for networking, catching up with old friends, making a few new friends. So hello to Stephania, who I met for the first time last week, which was nice. We were sitting next to each other and sharing information. So fantastic presentations, lots of discussion. And we had a keynote session with Her Royal Highness Princess Anne, which was fantastic. Very, very informed person about midwifery. It's fantastic to hear her speaking. And we had midwives from all over. We had midwives in clinical practice, we had academic midwives, we had student midwives, we had maternity care support workers. So there was plenty to talk about. And I don't think I stopped talking and listening all week. And that was just 2 days. It felt a lot longer from some ways, went fast. Now, this week has also been the International Day of the Midwife, which was technically it was Monday, and I think the celebrations have carried on Monday, Tuesday, and I know in my local unit, North Middlesex, and hello to North Middlesex, they had their celebration today, and I hear tell there was a lot of cake around. So well done. This is very midwifey sounding. And there was a lovely webinar from the RCM, and if you're an RCM member, you should be able to get a recording of this. I think it'll be released in the next few days. And we had Wendy Warrington and Shirley Stonge, beautifully chaired by Ruby Handley-Stone, very vivid presentations of support being provided to mums, families and babies in Ukraine and in South Sudan. Really humbling, really vivid, and it's unforgettable. So really, if you get the chance to see that video, do have a look at it. Fantastic. It's also been World Maternal Mental Health Day, and there's also a link on your resources to the RCM statement about maternal mental health being everybody's business. So do have a look at that when you get a moment. And actually, before we move on, because we've got a few minutes, I'd like to share, and I know Angelo is standing by, who's looking after all our production this evening, standing by to play this lovely video clip, which was made for International Day of the Midwife from our Anna and Sheena Byram. Everybody knows who from our friends at All for Maternity and the Practicing Midwife. So I'm not sure if you can cue Angelo. Can you cue the video?
Being a midwife. I love being a midwife. Hi, my name is Rochelle and I am the founder of Melanin Mothers. So why do I love being a midwife? I love being a midwife because it means that I can stand in the gap. It means that I can advocate and I can support when it matters the most. I can impart my knowledge and skills with birthing people and my colleagues. So, happy International Day of the Midwife.
I love being a midwife. I love being a midwife because I get to build relationships with the women and the families that I look after. I get to love them.
I love being a midwife because I get to see newborn families coming into being.
I consider it a privilege to be a midwife. I really enjoy advocating for women, particularly for those who do not have a voice. And I'm delighted that I'm a part of the midwifery family globally.
I am proud to be a midwife, honouring birth and empowering families, working as part of a team that recognises birth is powerful and that every story matters.
Why do I love being a midwife? Because being a midwife is more than a profession. It is a deep commitment to life, to women, and to justice. I became a midwife not just to turn birth, but to stand beside women when they are most powerful and most vulnerable.
I'm Johanna, midwife from Sweden. I really love being a midwife. Supporting women with love and compassion is my drive, and I really see that small miracles every.
I love being a midwife. I love caring for women and their babies couples and families at such a transformational and often vulnerable time.
Midwives make a difference in what we do, and I love still bringing that to the next generation. May you all know how special you are.
Being a midwife, we have such a privileged role where we can make small differences every day to people's lives. Not only do we witness new life coming into the world, but we have the opportunity to develop relationships with families and mothers.
Me being a midwife is an honour and a privilege, and seeing the transformation that women go through on their journey to meeting their new baby is an impeccable privilege.
Midwifery and midwives mean being with women and birthing people. It's not just about delivering babies, but it's about being there with them across the whole reproductive journey. It's about being able to offer compassionate, person-centered care, grounded in trust, in building relationships, being respectful to peoples and individuals.
I love being a midwife because it's about being there for people. You know, really being there when they're going through one of the biggest moments in their life. And it's about the connection, bringing some calm and just making sure they feel supported every step of the way. That's what I love about being a midwife.
A midwife because midwives hold space for support, listen to and empower pregnant women.
I'm midwife Marley, and I love being a midwife as it allows me to help those who are expecting a baby build the knowledge they need to have a safe and informed birth, supporting a positive early postpartum and parenthood journey.
What anchors me is the knowledge that midwifery is not just what I do, it's a part of who I am. It has shaped how I see the world through a lens of respect, advocacy and belief in the power of women's bodies and choices.
I love being a midwife because whatever country I go to, when I meet midwives and with my sisters, we connect and we have the same things in common. And I just absolutely love that.
I love being a midwife because I'm surrounded by individuals who want to provide the best possible care for individuals and couples who become families, and being part of that journey is absolutely incredible. So I feel really honoured. Happy International Day of the Midwife.
And also being part of the sisterhood of midwives for me is the biggest privilege too, because I look around me and all of these people I work with are just outstanding. They're inspirational, they're strong, they're fierce, they're phenomenal advocates. They speak up, they speak their mind, they're so...
I love being a midwife, mainly because of that connection you build with women and people when they are birthing. Just witnessing the rawness and that power of birth is just such an honour to have.
That was lovely. That was lovely. And I think it's easy to forget the joys of midwifery in the hard work that we have to do as midwives, and especially at the very time when we're very stressed. But hey, happy International Day of the Midwife. Let's stretch it to a happy International Week of the Midwife. I like that. So this week we're kind of looking a little bit of combining the International Day of the Midwife theme of midwives critical in every crisis, and also take an opportunity at career development, because that's very important. Because olden days you used to come in as a career and you'd sort of, it was a bit of a luck where you ended up, And nowadays, there's a lot more opportunities and a lot more planning needed to get where you want to go. And I'm so delighted to welcome Professor Patience Gyampeh. She's Associate Professor at Midwifery at the University of Suffolk and a Consultant Midwife at East Suffolk North NHS Foundation Trust. She specialises in research and development. She's got extensive experience in maternal and neonatal healthcare and is deeply committed to advancing midwifery practice and advocating for women and birthing people through evidence-based approaches. She's active, as you heard, she's actively engaged in research and currently pursuing a PhD focused on the midwifery, continuity of carer model and personalised care and support plans in maternity services. She's won loads of awards, and I think you need to go onto the Facebook page to see Patience's full resume, because this is really important to know. She's a rising star and an accolade from Turning the Tide project in 2021 for impressive career progression, which she's going to share, I hope, with us this evening. Welcome, Patience. The screen is now, and thank you to speak and share all.
Thank you so much, Sue. Thank you. That was very kind of you. The introductions was fab. Hi, everybody. I'm really, really excited to be here with you. International Week of the Midwife. As Sue said, we've had it fell on a bank holiday Monday, so we've all kind of didn't get the chance to celebrate it till the Tuesday. Today, it will be great for us to celebrate whilst we're on here. So I will be sharing with you. Next slide, please, Angelo. Thank you. I will be discussing just give you a bit of an idea of how to go about progressing your career in midwifery. One of the speakers that just spoke on the video that we've just watched said midwifery is a part of them, and actually I think a lot of us would agree with that. Midwifery is a part of who we are. It's just what we do, and for me personally, it was really important that I move from midwifery being a profession to midwifery being who I am, a career that I want to progress in, and I'll share that with you this evening. Next slide, please. Thank you. So I will be looking at becoming a consultant midwife, choices, directions, and routes. However, I do have a framework to share with you, and this framework is very much is transferable, so you don't actually have to aspire to be a consultant midwife to use it. It could be anything really within the midwifery remit or maternal and neonatal remit, or even those of you that have joined and are friends and families of midwives. It's something that you can use in your own career or industry. Next slide, please. I divided my talk into 3 sections. The first part will be looking at background and context, so a little bit of foundation of knowledge, so the role of the consultant midwife and the pillars of practice, very, very briefly. And please can I signpost you to the reference or bibliography links that Sue will be sharing, because that will give you a little more explanation of what the role of the consultant midwife is. Honestly, I will not do it any justice. There really isn't enough time. So I'll give you an introduction to what it looks like, and then I'll give you a bit of homework. The part of the presentation, we'll look at a case study, so using some reports from my colleague consultant midwives. Hi everybody, from the RCM network, who are very, very supportive, and I had a lot of career pathways which hopefully I'll be able to share later on and at some point. But for this presentation, I've got 3 examples of what career progression looks like, or how consultant midwives got to be where they are today, and then I will share my career journey with you as well. And then the latter part of the presentation is planning for success. So you do have to plan for your progression. It's not something that just comes to you. It's all a myth. Nothing comes to you if you don't work towards it. So choosing a career path. So I will look at some strategies for growth. I will introduce the IDA framework, which is IDA framework, and it stands for something, which we'll go into in a little while, and some key tips for you to take away. Next slide, please. So, sorry, the next slide is actually, Angelo, I do apologize. This will be a video from the RCM Consultant Midwives Network, wishing you all a happy International Day of the Midwife. So I hope you enjoy this video. Thank you.
We are RCM affiliated consultant midwives from the United Kingdom.
We would like to wish midwives around the world a happy International Day of the Midwife.
Who are we and how do we respond to humanitarian crises?
We are advocates.
We are educators.
We are counsellors. We are community health promoters.
Consultant midwives play a crucial role in humanitarian crisis.
We adapt to provide safe and effective care no matter the circumstances.
We are consultant midwives. We are here, ready to respond.
We are voices that communities trust.
For this year's International Day of the Midwife, we have one request.
We believe it's time
to take action.
It is time
to remove the barriers that hold midwives back,
so that we can apply the full scope of our skills to serve women, birthing people and children to the best of our abilities.
It is time to give midwives the tools they need to provide safer, more equitable and more personalised care.
We are here, ready to respond.
We are here, ready to respond.
Happy International Day of the Midwife.
Happy International Day of the Midwife.
Happy International Day of the Midwife.
Happy International Day of Midwife.
Thank you for all you do in times of crisis.
We are ready. We are ready to respond. We are ready to lead. We are ready to support midwives all around the United Kingdom to provide care no matter the circumstances. We believe that supporting midwives means investing in community health and resilience. We are consultant midwives. We are critical in every crisis.
Thank you, everybody. So that was our video from the RCM network. It's really lovely to see a lot of my colleagues in one video. So now I'll share with you how I became a consultant midwife, but I will go back to the little girl and where I'm from and what shaped me, really, because we all have a background. So actually, before I go any further, for inclusion reasons, for those that are also listening by audio, I am a Black woman. I've got braids in my hair and I'm wearing a colour block shirt made of black, red and white, and I have begun my presentation and I'll let you know when I'm done talking. So I'll continue. So the journey before midwifery. So I was born in Ghana, a country in West Africa, and my dad was a soldier, so I lived in the barracks, very, very regimented. Everything is very scheduled, which I believe is really shaped who I am, because I've always planned and I think I'm quite organized. I was raised by my grandmother, so hey to the grandmothers, you do a good job, and it was brilliant because she was a single parent, but she really did her best to make sure that we got good education and that we had a career. So I lived in North London, in Tottenham, so that's where I'm originally from. I went to a secondary school called Glazemore Community School. At the time, this is one of the pockets of deprivation in London. So obviously there were challenges. Even the school wasn't as great as it could have been, but now they're doing really, really well, which is really good to know. And went to college, did my A levels, went to university, did my degree in midwifery, and I think I became a midwife at the age of 21. So I was quite a young midwife, and I think it really helped me. Just kind of growing up, because in midwifery, and I think a lot of you would agree, you really do come in contact with challenges and you're actually dealing with real life. So where you'd have friends just the same age as you who are coming to you and talking about what they went to drink last night and, they're hangover, and you're thinking, no, I could never, because I've got work the next day or I've got placement the next day, So as a young girl, it was a little bit challenging, but I think looking back, it really did shape who I am today, because what it does is it grows you up. You have no choice. You have to mature in as a midwife, because your people are relying on you. You're dealing with families. These are real issues that you deal with. Your assisting birth. You have to be mature and you have to be responsible. So I think I became responsible at a very young age because of the career that I chose, and I don't regret it at all. Next slide, please. Thank you. So we'll go into the role of the consultant midwife very, very briefly. And those of you who are aspiring to be consultant midwives, what I would also advise is that you speak to your local consultant midwife to get a little bit more understanding of what they do, because the consultant midwife role, it does vary in remits. And areas of expertise. However, it all has to fulfill the pillars of practice. So the consultant midwives have been shown to be the key in increasing choice and personalization in maternity services. And you might hear the pillars of practice, the pillars of practice, the pillars of practice. And that's basically what I've got here in red. So we've got expert clinical practice, which is direct clinical care. We have leadership and consultancy, so that's professional advisory and policy. The consultant midwives do contribute to policy documents and part of discussions which lead to those as well. Research and evaluation, which is where I'm more kind of leaning towards in my role. So that's evidence generation and audit. And then you have education and development, which I do a lot of as well, teaching and practice innovation. Strategic service development is something that has been added onto the pillars. It used to be 4, but now it's 5. Consultant midwives do that anyways. It's just been acknowledged. So yes, strategy and governance is also part of the work that we do. Next slide, please. So becoming a consultant midwife, if you were wondering, actually, how do you become a consultant midwife? There really isn't a blueprint out there of the career paths that you should take to become a consultant midwife. And actually, you find that a lot of consultant midwives have just worked through and through hard work and recognition, and also through applying for jobs, they've kind of found themselves where they are. And a lot of my colleagues are very much enjoying their role. However, there are similarities in a lot of the things that we've all done to get us to where we are today. So if I've got 3 consultant midwives here, and this is their background, really. This is what they've done. So I've got consultant midwife 1, started as a rotation midwife, then elective cesarean birth lead, then band 7 coordinator, community midwife. You can take a screenshot of this if it would help, or you can go back and have a watch later on if it would help. Birth center midwife, birth center lead, band 7, bleep holder band 7, inpatient matron, then interim deputy head of midwifery, and then eventually she became a consultant midwife. So you can see the career path there. And then the middle one, consultant midwife 2, started off as a band 6 rotational midwife, then a caseload midwife, then a volunteer for humanitarian as a humanitarian midwife, and then patient experience lead, then labor ward coordinator, and then she was an associate midwifery manager. Then she became a humanitarian midwife in Haiti, then fetal monitoring specialist midwife, inpatient matron, lead midwife, consultant midwife. So you can see the first 2 really, really, um, there's quite a lot of experience there. You do have to work your way through. You do have to gain the experience, and you do have to gain the knowledge. And then you've got Consultant Midwife 3 here. Started off as a Band 5 midwife, then a Band 6 hybrid midwife, Band 6 caseload midwife, Band 7 caseload midwife, Band 7 home birth lead, then Band 8B consultant midwife, and then she then became a Band 8C consultant midwife after completing her master's. And having a conversation with her, she said that I wish that there had been advanced practitioner roles or trainee consultant midwife post for her back then. To kind of support the job that she did, but she went through it, and she is where she is today with a lot of experience. The career path varies. The banding typically falls between Band 8B and 8C, and most consultant midwives have master's degree, and a few consultant midwives have PhDs. They've already completed, and some of us are on the journey. So you can see that it is quite a healthy CV. If you would appreciate that consultant midwives do have a lot of experience, clinical experience. They have knowledge, and they also have a lot of academia behind them as well. Next slide, please. So this is my journey. This is how I became a consultant midwife. So I've kind of linked, because I've always been an academic. I've always worked and studied, because for me, I'm the kind of person that just want to understand everything and anything. I am quite I'm quite curious, and I always ask why. And I think my why always gets me to explore, and that's why I'm a researcher. I love research because it gets me to think, and it gets me to question, and it gets me to investigate. So I've always loved, I don't know, I just love studying. I think some of us do. So I've always done that. So I started my training in 2006, actually. I qualified in 2009. So I was a newly qualified midwife in 2009. And I remember this particular matron at the time when I qualified, I think 3 months into qualifying, she said to me, "Patience, I'm going to take you on a management course." And I said, "Why? I've only just started." And she said, "Well, I can see that you're very active, and it is something that you'd be good at." So I thought, okay, fair enough. So that was a leadership course that I did in 2011 there, that you can see at the bottom. So just to go back, I have done, in terms of clinical practice, sorry, I was a perinatal mental health midwife. I had a lot of interest in female genital mutilation, which kind of carried on from me being an undergrad, because I did it for my dissertation, and I explored the subject area. So I carried it on. And then I moved from the unit that I trained in and worked in for 5 years into another hospital, which was a tertiary unit in London. And I was really excited about that, because there was lots and lots of cases that I hadn't been exposed to before. And like I said, I'm always wanting to learn. So for me, it was a challenge, and I do love a challenge. So I thought, oh, this is a high risk unit. Let me go there and see what I can learn from there. So moving to that hospital in 2015 exposed me to a role in perinatal mental health, which I really, really enjoyed doing. So I did that role for about a year and a half, and then I became a postnatal ward manager. And I think this is where things changed for me, because I became a line manager. I managed about 40 members of staff on a 39-bedded postnatal ward with a transitional care unit, very, very busy tertiary unit in London. And that really tested my personality, and I learned a lot from that role. And I think that role, funny enough, when I started, and the matron that that appointed me, I still speak to her now. We always laugh about this. I started the role, and she said to me, "Patience, I have a project for you." I said, "Well, what do you mean you have a project for me? I'm a ward manager. I've come to do the rosters and sickness management, and to learn all this, and the day to day, the troubleshooting. This is what I'm here for." And she said, "No, I've got 2 managers that are already doing that. I want you to lead quality improvement." And I thought, I don't know what that is. What do I do with that? I'm a midwife. I'm not a project manager. What's this? Anyway, so she then said to me, and I remember this really well. I started on the 3rd of March, I believe it was, and she said to me, "You've got 4 weeks to turn the project around." 4 weeks. I had no experience. So I thought, okay, fine. I'm going to have to just start this from scratch. So I started doing some research. How do you manage a project? And I mean, we had a QI team within the hospital that I was working in. But did I contact them? No, I didn't, because I didn't know they existed. So I went to another hospital who had because she wanted me to lead the discharge pathway. They had a discharge pathway, and I basically went there and shadowed and learned how to go about it. And then I came back and I showed her my plan, and cut story short, I executed the project. And I really, really enjoyed it. It was really challenging. There were lessons learned. Going back, there's a lot of things I would have done differently in terms of engaging staff and carrying them along. Back then, I didn't know what that meant, so I kind of went about it a different way, which kind of resulted in a lot of resistance. But in the end, it all worked out. But I really enjoyed that, and I found my ikigai, and I'll tell you about ikigai in a minute. I found my ikigai in that role. I thought, this is me. So I went and studied project management. If you can see that in one of the clouds there, I went and studied project management because I thought, gosh, this is me. I love managing projects. This is me, So I did that. And then after that, shortly after I qualified, I became a transformation lead for a local authority on the Healthy Child program, which also very much linked into maternity transformation program. So I was just set for that. I was really excited in that role. I learned how to present. I learned how to draft presentations. I learned how to have meetings on a higher level and writing reports. And I was exposed to quite a lot of skills. And then following that, well, actually, at the same time, I started my MBA because for me, I wanted to understand the business side of the NHS. I mean, why is it that we're told to manage and, or budget? Why are we told that we can't book a lot of vouchers? Why are we told that, we can't order this sometimes, or we have to make sure that we don't over order this? And I thought, there's something going on that I don't understand. It's not connecting, and I want to know. So I studied MBA. And it was the best thing I ever did because I didn't have a master's degree at that point. So it was really worth my money. I loved MBA, and it really did expose me to a lot of the things that I know today. Following the MBA, I then became, there was an opportunity to work as a trainee consultant midwife, so to be trained into a consultant midwife role, which was brilliant because I had a fantastic consultant midwife who trained me, called Heidi, brilliant consultant midwife. She's still practicing, and she trained me, and I captured it really quickly, and I knew this was me because when I looked at the pillars, I'm very active, but I love clinical practice, I love research, I love QI, I love leadership. I just enjoy all the pillars, and I thought, this is me. So that was really, really exciting and really interesting element of my career pathway. And then I got the opportunity to become an associate professor and consultant midwife, and also enroll in a PhD journey. And I thought, this is brilliant for me. So that's where I am at the moment. I have done things in between. I've done a project in Malaysia for the United Nations, which was sponsored by the British Council. I kind of take opportunities as they come because I know that these things sometimes don't come again. And I will tell you more about that and how to actually grab the chance to do things. When things come up, you need to make quick decisions. I will talk you through that actually, because that's what my framework is about. Next slide, please. So when did it all start? These are just some pictures from Malaysia for you to have a look at whilst I talk through this. So professional growth, the why, the when, and the how. It all started in 2019, actually, when I decided that I am going to work on my success. I'm going to take ownership. I'm going to take control. And I had to shift from surviving in midwifery, because let's face it, I am a midwife and I love what I do, but it is challenging. It is very, very challenging. And sometimes you go and you think, I can't do this anymore. How long am I going to do this? I'm running out of steam. I'm always tired. These hours are long. And then you finish and you come home and you think, I can't even rest. I can't sleep. I have to go back tomorrow. And you give your 110%. And it's just a cycle. So it got to a point, and I will be very honest with you, it did get to a point where I didn't want to do midwifery anymore. I wanted to be a social worker, and I actually got accepted until my manager had to give me reference. The same manager who got me to do the project when I started my job, and she was just delaying this reference because she didn't want to give it to me. She just didn't want me to leave. And in the end, another opportunity came, and she said, "Well, there you go. This was a sign." I said, "No, it wasn't. You just did not want me to go." But yes, I was thinking of becoming a social worker, but thankfully it didn't get to that. But what I'm trying to say to you is that I was so frustrated, and this is because of the challenges. We've all gone through it. I've gone through it. I don't want you to have a look at my career path and think it's been smooth. It hasn't. I've had those moments as well, but I had to then kind of recalibrate my mind and go from surviving midwifery to thriving midwifery. So that's when I applied for a job as a matron, and sometimes you feel like this is mine. You have this entitlement. This is my job. Everybody knows that I'll be good at this. Unfortunately, I did not prepare for the interview. I had to take ownership. I did not prepare for the interview, and it was just dreadful. And actually, looking back, of course, they should not have given me the job, but at the time it was difficult to understand. But what came out of that really was a reflection and self-awareness. So I had this a panel member who was really, really great. She came back and she gave me feedback, and I wrote it all down. And that's when I started planning for success. Next slide, please. So strategies for growth. So for me, I have learned, like I said before, that embracing challenges can lead to greater professional fulfillment and opportunities for growth. And that I really want to get this across. There is no such thing as it will come to me. You really have to work through this. Next slide, please. I'll quickly go through the IDA framework, and please do go back and have a read, because this is really what helped me with my career progression. And for me, the aim is to empower midwives to navigate their career paths with clarity and confidence. Next slide, please. So IDA stands for intentions, decisions, and actions. Next slide, please. You have to, I think sometimes we kind of misunderstand when it comes to career progression. We do have this entitlement. I'm a midwife and I've been qualified for X amount of years, and therefore, of course, I should be promoted. This is what we think sometimes. No, it doesn't happen that way. You have to intentionally plan your success. You have to find your ikigai. Like I said, I found my ikigai. I know, and I realized that project management was me, quality improvement. Anything to do with projects you put me in charge of, I am confident that I can execute. So you have to actually sit down one day and say, who am I and what am I really good at in midwifery? Because we all are, we're all good at something. So ikigai, just to give you a bit of background, is a Japanese concept of discovering your purpose through exploring the intersection of what you love, what you are good at, what the world needs, and what you can be paid for. Because yes, we kind of try to avoid payment when we apply for jobs, but actually it is part of it and is an incentive. So you need to actually decide what you're good at, what you want to get paid for, and leverage on it. There's no need doing something that I'm doing because you admire me. Admiration doesn't have to be aspiration. You can admire somebody, but you don't have to aspire to be who they are. And I really don't want you to look at me to then think, I want to be a consultant midwife like Patience, because it might not be something that you want to do. So it's best you sit down and decide what you're good at and have a plan on how you're going to use that to grow your career. Next slide, please. decisions. So this is really important, and I think we waste a lot of time. So you identify what you're good at. There are two types of decisions, by the way. I'll talk about that first, actually. So type one decisions are those difficult decisions that you have to make. You have to decide whether this job is closer to home or not. How long is it going to take me to go? Is it going to be costly? Is it going to impact my family? Am I going to need childcare? Do I have childcare? You have to weigh those out. Those are difficult decisions. You don't make them easily, regarding the job that you're going to apply. Type two decisions are decisions that are easy to make decisions. The job is there for you. You can do it, but then you're sitting on it and you're going, well, I'm not sure, and you're making excuses. You're not applying for the job, but guess what? There is somebody else out there that is applying for that job, and you need to remember that these jobs are not waiting for you. Every job that you apply for is an opportunity to learn. Don't worry too much about whether you're going to get the job or not. It's about, okay, what can I learn from this process? Even the interview, if you don't get interviewed, even writing your personal statement is something to learn from. So let quick decisions remain quick decisions, and do not overthink. And don't get left behind, because actually the world will be moving. Next one, please. Actions. So this is based on the Let Me theory by Mel Robbins from her book Let Them. So the Let Me theory basically tells you to take control. You need to take control of your own life. You need to take responsibility of your own career pathway. Nobody cares more about your career progression than you. Don't blame anybody for what you don't become. You need to make sure that it's your job to make sure that you get to where you want to be. And then you can approach people to help you, to support you, so you can shadow them, to mentor you, to coach you. But you have to make that step. You have to take that action. Next slide, please. So that is IDA framework. Sorry, I had to rush through it because I'm very mindful of the time. But you can go back and have a look on the demand and stop and start and take notes if you wish to. So I is for intention. So intentionally plan your success. Find your ikigai. Decisions, be aware of the type of career decisions you need to make. Is it a type 1 decision? Is it a type 2 decision? And you would remember me when you think about this. The patient said you need to make it quick. Yes, it does. You've got to be quick. We live in a world that is moving fast. And I feel like sometimes as midwives, we're in our own world and we forget that there's a world out there. There are other industries out there that are moving really fast, and you kind of need to catch up. Actions, your career growth is your responsibility. Act on it. Okay, so IDA, IDA, intentions, decisions, actions. Next slide, please. Key tips. This is just a long list of things that you could possibly do, okay? And I want you to go home after this show and I want you to sit down and use IDA to plan your career, because that's why you're here today. I want you to be intentional. I want you to decide, when you've become intentional, what are the things that you need to do? And then you need to take action. You need to identify mentors. You need to network. I mean, gosh, I'm known for networking. I love networking. You just meet so many amazing people. Shadowing. I've shadowed a lot of people in my lifetime, and I'm still shadowing to know the roles that they're doing and what I can get from it. CV updates. Do you even have a CV? Sometimes, as midwives, we feel like we don't need CVs. Yes, you do need a CV. You need to write one if you don't have one. And if you've got one, you need to update it. It always needs to be updated. So when that job comes, remember, you need to be quick. Interview preparations. When was the last time you had an interview? Some people haven't had interviews from when they were band 5s, and yes, you have progressed and you have become a band 7, but it's probably in the same trust, because a lot of us remain in the same trust as well, which I would advise that you don't do if you can help it. Try and explore, go elsewhere. You need to move around. You need to expose yourself to what's new. The challenge part of it is really important. So yes, interview prep is important. Interview practice, podcasts. I love podcasts. I mean, this is my favorite podcast, by the way. I do listen to many podcasts about career progression, and unfortunately, sometimes we don't have industry specific podcasts for maternity. So that's why I'm here today. It would be great to actually have one of those. But if you listen to these podcasts, you can translate that into your own field. Exposure, you can do some volunteer work, practice journaling. So you need to write things down that you've done, because these are very easy to forget. Searching for jobs. You could like jobs that you would like to do. Look at the JD. What does it say? What does their personal specification ask for? Do you have those? Tick them. If you don't, you need to work on them. You have to be active. Academia, when was the last time you studied? Is there something that you need to do to actually give yourself a bit of credibility? To broaden your knowledge. Cover letters, have you written one before? If not, you need to learn how to do one. And supporting statement, when was the last time you did this? You need to have a look at all these things. It's a long list, but honestly, it's not as long as I would have liked it to be. So yes, I hope you can go and have a look and work on it. Next slide, please. So just to conclude, seek mentorship and continuous learning opportunities, build a solid network, and stay informed about industry changes. Yes, midwifery does change, and we're all very much aware. The world is changing, our women are changing, our birthing people are changing, and so do we. We need to catch up to them, so we'll be able to speak to them in the language that they understand. To enhance your career prospects and satisfaction. I think this is the last slide. Thank you so much, everybody.
That's the cue for questions, Patience. and some references. Thank you so much. That's fantastic. I think what comes over the strongest for me in that presentation is your enthusiasm and your kind of can do. Your managers suggest you need to do a project, and it could be very easy just to avoid that manager for a few days and just slink away. But no, you went and did it, and didn't necessarily follow exact rules. We've all done that. But you've learned from it and done so much. This is fantastic. And I think the similarities in the roles that I picked up in the different consultant midwives, because that's something that people often ask about, is that the similarities are the depth of experience. All of those three cases that you described, and those are just three of what could be many, when you probably, those of you in the audience, would find it useful to talk to your local consultant midwife and find out their little story, because they are the most ideal mentor for you. And maybe
absolutely
the progression, getting people progress. So thank you so much, Patience. Now, I do have a question so far, and this is from Sana Gull. Hi, Sana. Okay, this is quite a long question, Patience. This is, hi, Patience. What do you think about Masters in Midwifery for adult nurses? I'm an adult nurse currently completing my Masters in Midwifery, which is a pre-reg course. That must be, I think, the 4-year course. After which I'll begin my preceptorship as a Band 5 midwife. When I look for career progression opportunities, will this Masters be taken into account as a graduate course, or do I need to do another Masters in different specialist subject, like you did MBA or research, etc.? And I think I know the answer to this, but Patience.
Sue, please do go for it.
Tell Sana what she needs to know.
Sana, welcome to midwifery. It sounds like you do want to be a midwife, and that's why you're doing your Masters in midwifery. I think, yes, it definitely does count towards a Masters degree. And once you get into midwifery, you can look into how you can progress your career with that Masters. Yes, you are starting as a Band 5, but you might find that your experience and your skills from nursing is transferable. So don't be afraid to showcase that in midwifery when you come into it, because that's the other thing as well. We're very reluctant to showcase what we've done. That's something that I did learn as well. We're quite modest. but actually sometimes you do need to emphasize and be explicit with the experiences that you have so others know. It's just so that others can know what you can do. So yes, don't be afraid to showcase your experience and your skills from nursing, but yes, definitely you can use that as a master's. Yes.
And I think what you were illustrating, Patience, was, if there's some courses that fit what you need to know at that particular time, go out and get them.
Absolutely. Yeah. You have to
And
grab
ask.
it. Yeah.
And don't assume you won't be offered any support. You may, I know these days there's not so much money around to support courses and give you extra study time, but there are some support.
There are definitely some support out there, and also charities as well. There's quite a lot of grants that you can apply for. Sometimes we're not aware of these because of the field that we work in, but there are grants out there to support healthcare professionals. So do explore these as well. And yes, from charities, even within your trust charity, you can apply. Yes, they might not be able to fund a whole master's or PhD program, but they can possibly fund like a course or so, a module, sorry. So yes, that's a way to look at it. Yeah.
And that can be worth it. There's
Yeah.
in midwifery, there's the Alanthe Trust, of course,
Yeah.
and the RCM and the RCOG do some
Yeah.
in particular the research fellowships and things, don't they?
Yeah.
So that's a good point, Patience. Thank you for that. Now we've got some comments. Carleen York says, thank you, very informative presentation. Kathleen Hammond, thank you so much, very informative and inspiring. And Sana, who you've just responded to, it was inspiring, amazing tips, especially for students. Thank you for sharing. And Mimuna, excellent presentation, Patience, huge congratulations. IDA, key message and quick decision making. That's fantastic. I was sort of wondering about there was a consultant midwives course available. I'm not sure. Do you know of any of the courses that are still going on?
No,
Or is
I
it maybe
think
a sort of, a sort of more hybrid? It feels as though it's quite hybrid.
yeah, as it is, as it stands, I don't think there are any formal consultant midwife courses that are out there. And try not to get confused with the ACP courses because they don't necessarily result into a consultant midwife role. They are very kind of niche in the areas that they are targeted for. But there isn't, as we know, there isn't any courses out there specifically for a consultant midwife role. I think I'm one of the very few that have been lucky to be on the consultant midwife training. It's a trainee kind of role. Obviously, you're working it, and you're being supervised by a senior consultant midwife, and then you go through the competencies like I did, based on the Health Education England multi-agency consultancy framework. Which I found really, really useful. But yes, that will be trust specific though. So it depends. And this is why it's also good to explore what is elsewhere, because it might not be available in your trust, but it might be available elsewhere. So it's really important that you keep an eye out for these roles when they come up, that you actually apply for them, because you never know, you might get them. And some of them, they do start from band 8A. Mine was a band 8A. So it's not too bad actually. And then you progress into, a fully fledged consultant midwife. Yeah.
I like this fully fledged. I like this. And the other question I had as you were talking, because you're a consultant midwife and you're also an associate professor. Now, I'm interested in how you balance having two masters, as it were, or two mistresses, if you like, having the NHS and higher education, two bosses. How on
Yes,
earth do you do it?
it was actually very challenging when I first started, and I say this all the time. I'm a midwife, and that's never going to leave me. And I think, yes, I was an expert in my field as a consultant midwife, and then going into being an associate professor, you start research, and you're having to get into a different it's a new industry, I would say, you know. So for me, I started in 2022, and yes, I kind of dedicated a lot of my time being a consultant midwife, and then I had to remember, oh gosh, I do have another hat on. But as time's gone on, I've kind of, and I was saying that to a few of my colleagues the other day, that I've kind of created, I've made it work for myself, where the research is coming into clinical practice, and now I understand that the two are not separate, and actually they complement each other. You know, we talk about evidence-based practice. Where do we think that's coming from? You know, we as midwives need to make and find our own evidence. We need to be researchers whenever possible. So I know, yes, we can't all be researchers, but it's important that we have our own literature, we have our own evidence to support the midwifery model of care. You know, so I think for me, yes, I have now learned to balance that, and I understand that actually it is one and not two separate roles. And once I started thinking of it that way, it became so much easier. Yeah.
And of course, you're developing your research into what you want to do as well.
Exactly, into my PhD.
Fabulous.
So
Thank you.
yeah.
And I have to say, I loved your project management story. Just that really, and I'm sure that will sort of tune into a lot of people who've been through that sort of experience.
Yes, don't be afraid when the challenge comes.
Just go for it. Just go for it. Now, I've got Sana, who's having another question. Sana, when we last had the NMC session in Midwifery Hour about the new proficiencies needed for ACP and CM, they said one must do all the pillars at ACP and additional consultancy for CM.
Additional
I
think
it was that additional. I think
strategy.
Thank you, Sana, for asking that, because I think that's that final pillar, isn't it?
The strategy and governance. Yeah. So that's strategic. So that's also been added on. So, I mean, I don't want to be certain about this, but that document, the Health Education England documents, the multi-agency consultancy framework, is actually a guide for all consultancy practice within the NHS. And it has the pillars that it should all be based on. And that is what the consultant midwife pillars are based on. So they added on strategy and governance, and that means that we've obviously added it to our ones. So I'm not quite sure whether the ACP, pillars is going to add that to it, but I think, if you are kind of already on an ACP course, you would probably come across that anyway. And we come into, strategic work all the time in midwifery anyway. So if you are a leader in midwifery, it's no doubt that you would be strategic as well in your role. Yeah, it's just to make sure that it's emphasized that this is actually part of the things that we do. And I think, to be honest with you, a lot of consultant midwives have been doing the strategic aspects anyway of being a leader, but it's just now a little bit more recognized as, this is part of the role, and governance as well. Some people actually, that is the majority of their responsibility, governance and strategic work. So yes, yeah.
I mean, I have to say, it's very interesting that I think when it was first came up and it was announced that there were going to be consultant midwives, it was hugely exciting, but that it was very much a blank sheet. And I think that good on the consultant midwives who shaped the way it is to make it fantastic, potentially, for the consultant midwives, but also, more importantly, for the women and babies and families.
Absolutely.
And the greater kind of community of midwives, because it's huge potential. And a lot of people had to leave clinical practice to be promoted. Whereas with a consultant midwife role, you can stay very firmly rooted in clinical practice.
Yeah, and I think that's why a lot of us enjoy our role, because we're still hands-on per se, we're still in that clinical role because it is part of what we do. And actually, sometimes you find that 50% of the role of the consultant midwife is clinical practice, and a lot of us enjoy that as well. But the role is evolving. You know, it is
Still
evolving.
evolving.
Yeah, it's still
Still,
evolving. You know, so yes, it is a blank sheet started as, but
yeah.
you know, we keep adding to it. And actually, if you want some more information, the RCM website is the best to visit to
Oh,
get a bit more,
fabulous.
information on the role of the consultant midwife. There is a career framework for it. So yeah, have a read.
Okay. Well, we've enjoyed your career framework. Enjoyed that coming to life. Now, there was one more. Emma Corcoran, hi Emma, says, thanks so much, Patience. I really needed to hear this today. Some really strong and powerful messages from your presentation. So I think Emma speaks for us all. I think you're a fantastic example of a consultant midwife and what you can achieve and the kind of route and pathway you have to take to get there. So thank you so much. I always say at this point, this hour goes so quickly. It's the quickest hour in the whole week. And this hour's flown by, and it's been really fantastic. So thank you so much for being with us, Patience.
Thank you for having me.
I'm sure we're going to have Patience back, because if nothing else, we're going to get to come and talk about how she got through all the ethics, because I'm sure the researchers would be really very, very interested in that, because that I know that for researchers, this is a struggle sometimes. So thanks for Patience. Also, thanks for Angelo, who's moved along slides and also is making sure that this is all beautifully ready to go out Friday morning at 6 o'clock in the morning and next Tuesday. For those of you, you'll get that link if you've registered with us. And Paul also, who's been looking after all the questions and comments coming through to me. So thank you to Paul. And now I'm going to say next week, we're going to have a bit different. We're going to look at pregnancy and motherhood in criminal justice settings. And we've got Dr. Laura Abbott joining us next week, which will be really interesting, especially given some of the media information recently. I think this will be very transfixing. I know you're going to find it interesting. So in the meantime, please do keep yourselves safe and well. If you haven't enlisted for the next festival in Nottingham, is on the 20th of May, and if you register, you can get the sort of slideshow afterwards as well, so that's there available. And remember the Ikigai. I love this. This is one of my take home, because I think that's so important, because that's what makes us tick, really, isn't it? So thank you to everybody. We'll see you this time next week, same place, same time, but different speakers. So thank you, Patience. See you later.